Thank you so much for your reply. I just wanted to create a quick video and explain you what we do. So in the next 2 minutes, I'm going to cover about the patient generation system, how we are able to get consistent number of appointments for the specialty clinics we are currently working with. So we have created a patient generation system, which is a mix of running targeted ads and bringing these inquiries to your clinic at the reception as an appointment. So, and currently we are working with many clinics and medical centers and specialty clinics, and I'm going to show you the results and the process as well. So what we do in this patient generation system is firstly we do the groundwork. By groundwork, what we mean is we optimize your clinic on Google Maps and other specific location. We make sure that your keywords and all the details are present and the Google Maps page is set properly. Then we make landing pages, and then we set up the sales CRM. This is like a mobile app which your team would have, maybe your reception staff or your sales team would have, and they will be getting the inquiries on their phone, and they just have to call the patient inquiry and then mark them as qualified. And once they're marked as qualified, they can set up the appointment in the appointment booking system. The next thing what we do is we run targeted ads. Our belief is that you as a clinic owner, you should be available, your clinic should be available where your patients are. So if your patients are spending time on Instagram, Facebook, Google, if they're searching for the kind of solution on Google, or if they're spending time on YouTube or TikTok, you should also be present there, and your ads should be shown at these platforms. The ads what we create is a mix of creative design process. It's like something which is very engaging and very good to see, and it is also a mix of analytical. So we understand the numbers really very well, and we try to get the cost per patient inquiry. Once we know the cost per patient inquiry, it becomes very easy and predictable for us to raise the budget next month to get more number of patients and more number of inquiries. And once we know how to qualify and take them to the next step, it becomes much predictable and very easy for us to decide and get more number of patient bookings. Similarly, we run ads on Google, YouTube, and TikTok, and we try to get you better quality leads and better quality inquiries of the patients. The ads typically are going to look something like this. So these are some of the ads which we are currently running, and they are giving us very good results. So if you see, it's meant for different clinics, and currently we are running these ads in the UAE and also in UK and in other countries. So we are able to showcase the clinic and the process and the equipments and the whole entire journey of a patient in different ways, and we have approached taken a different ad angle, and we've tried to showcase what we do and how the kind of quality of equipment the clinic has, the experience the clinic has, and then we are able to generate the inquiries accordingly. So that's how the targeted ads run, and we are able to easily target the patients on the basis of the search which they are making on Google, or the kind of behavior they are making on the social media platforms. Then the leads are entered in a patient inquiry system. This system is a mix of a CRM, a sales CRM, which looks something like this. So each and every inquiry coming from your website, from your ads on TikTok, Facebook, or other platform, they all come on one single dashboard, and your sales team or your reception staff just have to call them, qualify them, and mark them as booked. Once the meeting is booked, once the appointment is booked, as you see, these are the appointments which this is a dashboard of one of our client, which is a clinic here in Dubai. So these are the appointments which got booked just today itself, and these are all the meetings which got booked. Once the meeting gets booked, they are put in a calendar system, and this calendar system sends them reminders one day before the appointment and also 1 hour before the appointment, and it makes sure that the number of no show decreases, and these patients are coming for the appointment once they have booked an appointment. So these are some of the appointments which are booked for today, for tomorrow. So that's how your calendar is also going to look, and that's how even we are going to help you in setting up your appointments. The third thing which the patient inquiry system has is a WhatsApp support system, again with the same belief that you should be available where your patients are. So the WhatsApp system is something like this. The patient goes to your website, and even when an ad is running, they are shown the number where a patient can make an inquiry, and the inquiries land up here on like this. So they're just saying I need to avoid glasses, then we are just initiating the chat with them, asking them the age, and we are trying to qualify them. And once we feel that they're qualified, then they're booked in the system as as a patient, as an appointment. Now, this whole inquiry system is linked back to the Facebook API. It's a smart way for us to tell Facebook that these are the kind of patients which you have given in this week are really qualified. They have taken our services. They have taken, they have that kind of paying capacity. Please get us more of these type, like people who are falling in the similar kind of income level and age group, and then problems as well, and get us more of these sorts. So this is like a method for us to retrain the Facebook algorithm and the AI and get us more of that sort of patient inquiries. While doing this, it makes sure that the cost per patient also decreases, because we are kind of tapping to the patients who are not tapped by other competition in your area. Lastly, there is an email and WhatsApp drip system. This system, once an inquiry is made, they are constantly sent email and WhatsApp messages just to educate them more about your clinic, the kind of quality services which you provide, the equipments which you have, any awards and recognitions, anything. So we can set up a drip system. It's like a way of regularly giving them more updates and more educational content about your clinic, and then booking them back as an appointment. So this is the patient inquiry system. The last thing we have is an online reputation management system. So it's a very simple and easy system which lets us collect 30 to 40 reviews every month for the clinics currently we are working. By the system, what I can show you quickly is the patients, 6 hours after they come for an appointment, they're sent a link on WhatsApp, email, and SMS. And once they click on this kind of link, they come to a landing page. And depending on the rating what they're going to make, if they are going to make give you 4 or 5 star, they are given the link to put your review on Google page or any other page which you're linking, or they can even upload a video testimonial and it can come to you as a video review. Now, the best part about this link is, if they have some kind of misunderstanding, or maybe some issue which has happened with the staff, and if they're going to put a negative review on Google, instead of them putting a negative review on Google, they will come on this link. Once they put 3 star, it comes to you as a private feedback. They're not taken to the page, the Google page. It comes to you as a private feedback, and then you can resolve the issue immediately. So it's the negative things are in a better control, and you can resolve it immediately. So that this particular system helps us in consistently getting more positive reviews. And once you start getting more positive reviews around your location, it gets you more number of inquiries for free. So that also helps our clients in getting more number of reviews and getting more number of inquiries. As and when they do this thing regularly, they start getting more inquiries, and then the overall revenue increases. So that's about it. That's the whole system in brief. My name is Jay Patel, and I have more than 18 years of experience helping clinics and helping doctors get the right kind of patients. I have also authored a book called Start with Jay. This book also talks about my strategy and my experience of how, as a business in a particular location, you can grow and get more number of inquiries and patients. I have dedicated my career in growing medical tourism here in the UAE, and I'm working with a lot of doctors. I'm currently working with Dr. Anwar, who is the founding member of Dubai Healthcare City. I'm helping him get more patients for his clinic and his other activities as well. Recently, he had his book launch, so I helped him with his personal branding activities as well. There are other doctors I'm currently working. Dr. Meyer, he is from Germany. I'm helping him get more patients, and whenever he travels to Dubai, I get him a lot of appointments booked before he comes and gets all the surgeries done, and he goes back. There are other doctors as well. We are currently working. So this is like a patient generation system which actually works, and this is something which we have refined, and it's like a system which even you can apply for your clinic. And if you feel this is really helpful, I would request for a call with you. We can discuss face to face. You can tell more about your clinic, and together we can come up with a good strategy to help you get more patients and to help you get more revenue for your business. Thank you so much. I'll see you on the call.